is the Dan York Show.
3:52, Bill Bartholomew in for Dan here on the Dan York Show on WPRO. We are, wrapping up a conversation about, number one, testing and ramping up our testing apparatus, not only to the point where it was in the thick of the pandemic, but also to a new level, and especially on the community level, where access and turnaround times are significantly improved. Also, kind of getting your thoughts on yesterday's press conference. We go back, we actually start out on the phone lines today. We go to Andrew in Providence. Hi, Andrew. You're on with Bill Bartholomew.
Yeah, hi. You made a comment about basically reiterating the Dr. Scott mantra that masks work, and then you said something about masks stop the flu.
Well, what I said was last year we saw a very limited flu season that, can you directly attribute it to, wait a second, can you directly attribute it to the mask usage?
Excuse me, Bill, it has nothing to do with masks, okay?
Okay.
It has absolutely nothing to do with masks. My background is in clinical trials and epidemiology. So I review the literature, the randomized control literature on community masking. Okay, so you understand the difference between randomized controlled trials and observational studies, basically?
Yeah.
Okay, randomized controlled trials involve a randomization process so you get rid of all the biases that are in observational studies, which can be manipulated before and after the fact.
Okay, how does this tie into the flu, though, in terms of last year?
Let me finish. There have been 11 randomized controlled trials of community masking for the prevention of influenza involving a total of 12,000 patients.
Okay.
They are all negative, all peer-reviewed.
Okay, so wait a second. So when these trials take place, wait a second. When these trials take place, let
me finish. You're not listening.
When these trials take place, are they surveilling people 24 hours a day, 7 days a week, or is this based on polling in terms of mask usage?
It's not polling. You don't understand. The trials are designed at medical centers. They've involved university settings. They've involved Hajj pilgrims. They've involved private homes. They're done through family practices. They've involved the entire gamut.
But what's the central point when it comes to the idea that last year we didn't have much of a flu season here in Rhode Island and people were masked?
To do with masking.
Then what did it have to do with? Just random luck?
There's a well-known phenomenon of viral interference where if one viral species is predominating, it can crowd out others. This is well known.
But wait a second. Let me ask you this, Dr. Boston. Why are you the only one that pushes this stuff out of an entire sea of medical professionals? Why is it only you that pushes this?
That's not true at all. It's not a question of pushing either, Bill. It's a question of hard evidence.
If it's hard evidence, then why is this not pushed to the top of the discussion by medical professionals writ large?
Between 1917 and 2020, the idea of community masking was considered ridiculous. It had been tried during the flu pandemic of 1917-18, and it was relegated to the dust heap.
Wait a second, that's not true. Look at Southeast Asia. Look at Japan. Look at South Korea. Look at China. These masks are used on a regular basis, year in and year out.
Excuse me, Bill. Japan has done randomized controlled trials of masking for the prevention of respiratory illnesses, and they're also no.
So why are people wearing them? Just for a decoration?
It is a cultural phenomenon, okay?
No, come on. So people just wear the mask for a culture for absolutely no medical reason?
Listen, pal, you get on and you go to press conferences and you cast aspersions on people and you know absolutely nothing.
I know absolutely nothing, right?
I'm giving you hard evidence from randomized control trials. This is how we decide interventions in medicine.
Who's we? Because you're the only one who's pushing this. You talk to medical experts from Brown University through the local clinic in South Kingstown. Nobody else is saying this.
The country of Sweden, which has half the COVID mortality rate of Rhode Island, okay? And it's a much more complex, and it's an entire country. Stockholm is about 10 times the size of Providence and the Providence area. Okay, they've never masked throughout the entire pandemic. They have half the mortality rate that we have here.
They don't have even a smidge of the globalization and import-export of human beings from around the world that we have here in the Northeast Corridor of the United States. It's not even close to a fair comparison in terms of the types of people movement that takes place on a regular day-in, day-out basis. And you know what? You want to call up and say masks don't work to people? You're a danger to this community when you say that kind of stuff. That kind of absolute nonsense. That is completely and 100% ridiculous. And there's absolutely nobody else that has come out with that kind of statement that masks don't work. And we're not talking about specifically the Department of Health. We're not talking specifically about Dr. Alexander Scott. We're talking about the family doctor. We're talking about people who are in academic health systems. We're talking about people who are in public health systems, private health systems. I have not heard one other person push that type of paranoia out there into the community on a regular basis. You are causing alarm, confusion amongst people in this community, and it's absolutely preposterous that you continue to push this kind of nonsense. If you want to communicate this point, you got to find a way to do so in a succinct manner, because the rollout of this study and that study in 1917, dude, last year there was barely any flu in Rhode Island. People were wearing masks. Is it a coincidence? Maybe. Probably not. 4 o'clock, time for the news.
WEAN-FM Wakefield Peacedale from the Paul Massey Studios, celebrating 30 years of automotive excellence. Live and local talk and information. This is WPRO, Providence, a Cumulus media station.
Good afternoon. In the Trusted Choice Insurance Agents News Center, I'm Paul Zangari. It's the 4 o'clock WPRO News.
At HealthSource RI for Employers, we provide access to health insurance to more than 1,100 local businesses and nonprofits, and 96% of them renew through us every year. Maybe it's our choice of 19 different health plans, our 10 years of customizing solutions, or our one local team of dedicated experts helping employers find quality health insurance. See how our numbers stack up for you. Learn more at healthsourceri.com/employers.